All right, let's get started. So here we are going to perform diagnostic ultrasound scan of the lateral knee. If patient comes in with lateral knee pain, I will usually start from evaluation of patella tendon. And I usually put patient in the lateral recumbent, which she already knows, so she's already in the lateral recumbent position, which is crazy because, we've never done this before. Just kidding. And what I will start with is first visualize that patella tendon and scan laterally. So that's how I would do it. I will do the basics first. And then as the time allows, I will start scanning other more advanced structures if that's okay. First, I'll put the transducer in longitudinal orientation, meaning transducer is this way, over patella tendon. And the reason I put the patient lateral recumbent looking away from me is it's always good to use flexor. Flexor is stronger than extensor. It's difficult to keep scanning this way, much easier this way. Palpate, put the transducer. Patella, tibial tuberosity. Now optimize the image. I'll scan laterally. You'll see recession of patella tendon. And you begin to see Gertie's tubercle. But interestingly, she actually has irregularities of the anterior edge. She's played sports active with previous history of lateral knee pain. So this might be the reason why she's in pain. However, what I want to pay attention to is this. This is IT band. I'll scan this proximally to see IT band over lateral femoral epicondyle. And this is the area where you might see the fluid if you have an IT band friction syndrome. I'll come back here distally. And then now you are paying attention to a vessel pulsating right over here. And this is lateral femoral geniculate artery, deep to which you see a meniscus tissue. Evaluate that. Now direct attention to proximal area. Now I'm going to look for LCL, one of the best static stabilizer of the lateral knee. But it's difficult to find it in long axis view. When she's thin, ligament will be very thin. So what I'll do is I'll rotate the transducer 90 degrees to be transverse in orientation. Transverse over the lateral femoral epicondyle. It starts in the posterior edge, so right over here. And you'll scan this distally. That's the LCL. Control for anisotropy. You can make it darker. It's easier to follow in the anisotropic view as opposed to isotropic view because you've got this popliteus tendon coming in here. This is a popliteus tendon in short axis view, oblique short axis view rather. So, it's kind of difficult if both are bright, although you can see the tissue separation here. So then what I'll do is anisotropic view of that ovoid circular structure, which is LCL. You can follow this distally as I go over the joint space. What I will start paying attention to is a structure that emerges from the posterior side, which is tendinous in nature. So this is LCL, and this is the biceps femoris tendon with muscle joining from the biceps femoris tendon. This is a short head of the biceps tendon's muscle forming tendon. As I scan distally, you can see this one merging, blending together. So biceps femoris tendon merges with LCL. So once again, LCL, and gel is running out. Biceps femoris tendon, LCL, biceps femoris tendon, LCL. These two will merge as I scan distally. See that? Here. You see it? So what it is basically LCL comes anterior to posterior this way. Biceps femoris starts here, creases this way. So by the time it gets to the fibular head, biceps femoris anterior, LCL posterior. So it's like this. Okay? And then one more thing is now I'm directing attention to LCL, biceps femoris tendon, scanning distally. LCL is coming here, but we will ignore this for now. Pay attention to this. It will send a fiber here, 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 here. Send a fiber. This is tibia, by the way. Do you see that tendinous structure inserting to the tibia? That's the tibial arm of the biceps femoris tendon. So we are short access to the biceps femoris tendon proper here, short access to it. But then because the orientation changes as this sends the fiber toward tibia, it suddenly becomes, this sends fibers to tibia this way. It becomes in plane long axis view here. So this is the tibial arm, biceps femoris. And this creates pain in this location upon knee flexion, because it's a biceps femoris hamstring, a knee flexor attached to the tendon that inserts to the lateral edge of the tibia. So it's a weird diagnosis, flexion of the knee results in anterior lateral knee pain. So if you ever encounter it, remember Onishi and treat the tendonitis and it gets better. All right, so that's the basics. Patella tendon, IT band, lateral meniscus, LCL, and appreciation for tibial arm biceps femoris. Let's do that.